Health Canada thought that the media would be critical of their authorization of the novel COVID-19 injections for youth aged 12 to 17, but that criticism never came.
Today, Health Canada authorized the 10 microgram Pfizer-BioNTech Comirnaty COVID-19 vaccine for use as a booster dose in children aged 5 to 11 years. And NACI released a national guidance for its use in Canada.
In a Health Canada release package that I have been patiently waiting for 3 years to receive, requesting the risk versus benefit calculation used to justify the authorization of Pfizer's novel COVID-19 mRNA injection in youth, the agency now disclosed that they thought media would report critically on the strength or lack thereof clinical trial data rubber-stamped by the agency, since they were the first country to approve this injection for use in this age group. This exclusive investigation is years overdue, but thanks to your generosity and support at rebelinvestigates.com, we have been able to stay on top of this seemingly endless follow-ups and prompts for release, which I initially filed in May of 2021 when emergency department physician Dr. Mark Benoit was expressing concerns around the rollout of this product for a not at risk of COVID complications demographic.
They say, well, it's going to change the results of your blood tests. We don't really know if it's going to protect your child from getting COVID, and we don't really know if it's going to protect your child from dying. So what we have is it is 100% effective in changing the results of a blood test. And we think that that relates to its efficacy in terms of preventing death, but we don't know. Is it warranted to push through a product whose safety is really unknown and whose efficacy is really unknown? Is there an emergency that warrants doing this? And in my opinion, no, there's not.
You see, a Biologics and Genetic Therapies Directorate sent from the person responsible for authorizing these injections, Celia Larenko, the Director General at Health Canada's Biologic and Radiopharmaceutical Drugs Directorate, to Leo Boutillier, manager at the Office of Clinical Trial Data at Health Canada, on May 5th, 2021, asked the following: is there reason to anticipate media interest or a negative impact for the department when the clinical data package is released on the Public Release of Clinical Information (PRCI) portal? They clicked yes. Below it says, see release of information on the PRCI portal section below for considerations leading to this opinion. The release of information section says, there will likely be media interest. There may be questions regarding the strength of the clinical information provided to support the safety and effectiveness of the vaccine in the adolescent population, as Canada was the first country to approve it. There may also be questions whether the sponsor appropriately addressed the requirements for an issuance under Section 5 of the interim order. Section 5 of the now archived interim order, which became a permanent piece of the authorization process through regulatory amendments on February 22nd, 2023, says the following. Under issuance, the minister must issue the authorization for importation or sale if the following requirements are met. The applicant has submitted an application to the minister that meets the requirements set out in subsection 4.1 and, if applicable, subsection 4.2. The applicant has submitted to the minister all additional information or material, including samples requested under section 9. The minister has sufficient evidence to support the conclusion that the benefits associated with the COVID-19 medical device outweigh the risks, having regard to the uncertainties relating to the benefits and risks and the urgent public health need. And finally, the minister determines that the health or safety of patients, users, or other persons will not be unduly affected. Now, I've been on a quest to determine point C, how the supposed benefits outweigh the unknown risks, since May of 2021, because it turns out that the government-funded mainstream media wasn't interested in anything other than cheerleading the novel injection into the arms of innocent children and youth with headlines like, "Making History, First Northwest Territories Teen Gets COVID-19 Vaccine," and even going so far as to promote minors getting their injection without their parents' consent. Heartbreakingly, the headline would follow a month later. Sick Kids reports handful of rare heart inflammation cases following COVID-19 vaccine.
And I know almost half of kids across this country have gotten their vaccine from ages 5 to 12. We need to get more. So please ask your parents if you can get vaccinated. Getting vaccinated protects yourself, protects your family, protects your grandparents, protects vulnerable people, but it also supports our frontline workers who are working incredibly hard, our nurses and doctors and people in hospitals who are dealing with a rise in cases.
Now, according to this directorate, the efficacy of this injection was solidified when there were 0 confirmed COVID-19 cases identified in the vaccine group and 16 in the placebo group. Evaluated 7 days after dose 2, the efficacy of the vaccine was therefore 100%. That's right, they say that the injections are 100% effective because of a laughable 7-day follow-up. Stay tuned as I continue dissecting the contents of this document at rebelinvestigates.com, and thank you in advance for your support there. For Rebel News, I'm Tamara Ugolini. In addition to our exclusive investigations website, rebelinvestigates.com, we've also launched a campaign calling on Federal Minister of Health Mark Holland to revoke market authorization for these injections. You can find out about that at nomoreshots.ca. There you can sign our petition, send Minister Holland a form email, and of course, support our work if you find it important. All of that at nomoreshots.ca.